Thank you so much for having me. It's such an honor to be on the podcast with you. Yeah, so ever since that conference, the Adult Summit, I just have been just in awe of you. I've been a fangirl.
We all are.
Oh my goodness. I'm embarrassed.
Janie,
I'm
you've got
turning
a fan
red.
club.
I'm turning
You are
red.
turning
Really
red.
are. Good
Look
thing
at how
this is
red you
audio.
are.
I just fangirled all over Emily Kingsley. Do you know Emily Kingsley, Ruth? I mean, it shows my age. This has to be cut out. It
I think people know her poem more than her name.
Do you know the poem Welcome to Holland?
Yes, I do know
That's
that poem.
Emily.
Yes.
Emily
Yeah.
was a producer for Sesame Street in the 70s. And she had a baby about the same time I did with Down syndrome. And she was told, just like I was, put him in an institution. He'll do nothing. He'll just grow bigger. And she didn't. And then she brought disability onto Sesame Street. That's the reason kids with disabilities are included in Sesame Street, is because of Emily. So I fangirled yesterday.
Yeah.
Well, I want to welcome into our studio today Dr. Ruth Brown-Ennis. And I have known Ruth so long she was just Ruth Brown. So we met in 2019 at the NDSS Adult Summit. It was the second one in Detroit, Michigan. And I fell in love with Ruth. She's so knowledgeable about all kinds of things related to mental health issues and wellness for people with intellectual and developmental disabilities. And so we wanted to talk with Ruth today about some issues that some families we chat with have been asking about. And there's a lot of questions about how do we support our loved ones who are aging with Down syndrome when they start showing signs of anxiety. So we are so glad you're here because, you know, we each have some simple ideas, but I think that you probably can get us better directed. So welcome, Ruth. Just to get us started, how would you define anxiety in an older person with Down syndrome, somebody 40 and over?
Anxiety can present itself in a number of different ways. I mean, generally speaking, anxiety is our kind of threat detection system at work. And, it can span from thinking about the future and kind of worry-oriented anxiety, what's going to happen. For some folks, that's maybe like what's going to happen later today, like what's the schedule going to be? That's kind of a worry, And then you have more kind of specific fears, and that's like a more kind of in the moment, I'm feeling threatened right now, as compared to that kind of future-oriented, maybe something bad might happen. And then panic is just that like really intense in the moment kind of fear. And so for people with Down syndrome, people who are aging in general with Alzheimer's, I think it can kind of span those intense, feelings of threat. They feel in danger, they're confused, they don't disoriented, maybe don't know where they are, don't recognize the people around them. There could be, kind of fear around like just kind of loss of, their kind of perception, their ability to see, feeling where they are in space, maybe, less stable. Sometimes medications can compound those kind of sensory, issues. And that can be very scary, to just like having difficulty navigating your environment, and especially if that's a newer thing, can be scary. And then there's just that like confusion, disorienting, just not, not clear what the patterns are. I think you had mentioned something about, just like asking like, what are we doing today? Like, what are we doing today? What's the plan? I think those are signs of anxiety, and that just like a loss of control, a loss of predictability, which is something that's just very fundamental to our sense of well-being, of being able to feel like we can predict what's going to happen. We have some sense of control that gives us a sense of safety. And so we don't have predictability and control, then we feel anxious.
So while you're talking, I'm thinking about my son, Matt. He's 51 and probably in his mid-30s. His psychiatrist diagnosed him with depression and anxiety. I still don't know why he's got a depression because, he's nonverbal. So he uses a very few, he can say mom and hi and stuff, but not real communicative verbally. Uses some signs. But I've never been able to figure out why did he get an anxiety diagnosis. But I have always known that it's like he doesn't have control. Everything he does is dependent upon the staff who's with him. And I've often wondered, how does he deal with that? Not being able to use words to communicate.
I think it's got to be very frustrating, for adults. I mean, for anybody, any kind of human being, but I think, especially with adults, as we get older, we want more autonomy. We want more, kind of say in our daily life and, and in the big picture of where our life is going. And I think for folks who, have, nonverbal communication or, where, that expressive language is more impacted, I think it increases that, and I think the research tells us that, for people with Down syndrome specifically, that oftentimes their kind of receptive language skills are better than their expressive language skills. So there's more going on inside than what they're able to communicate, and so often people make assumptions about what's happening inside based on what they're able to communicate. And so I think that is a significant challenge.
Can you explain the difference between what you just said, receptive language versus expressive? Thank you.
Yeah, of course. Yeah. So the receptive communication, receptive language is our ability to kind of understand what other people are saying, and kind of picking up. And people with Down syndrome have relatively strong receptive language skills. So they understand more than what then they're able to express. And so, and that can be expression, verbal expression, ability to use an AAC device or sign language or, or whatever. But it takes them longer to kind of put together the pieces, of things that they want to say to be able to communicate that, and so unfortunately, I think people then underestimate what they're able to do, based on that. And so I think that's got to be very frustrating, to feel like you have something that you want to say, but not being able to kind of get it out, or people not understanding that, I think can be very, very distressing and very upsetting. And then when you have people controlling you, saying where you're going to go, what you're going to do with your time, I think that does set up people for, for experiencing anxiety and frustration and aggravation and, and all of those things.
So I have a question. I'm just building off of that. What would be some of the solutions to helping people who are experiencing anxiety, particularly in regards to dementia and changing I think you talked about visual perception, proprioception, right, where we are in space, memory, I don't know what's going to happen today, all those sorts of things. If you could maybe talk about some interventions that might be helpful.
Yeah, I think, I think there's a lot that, we can do just like on their environment, trying to, kind of simplify the environment, kind of reduce the, the demands on, like their proprioception, for example, like, if we can kind of, minimize like the stairs that they're going to have to climb and things like that, can be helpful. Having the NTG, the National Test Group, dementia has some really great recommendations on some like environmental supports, increasing, like the contrast of, like the light switch, so they can, they can more clearly see, kind of things in their environment. I think is helpful, for increasing functioning, but I think part of that is also decreasing anxiety. I think that, is those things kind of go part and parcel, together. Having a visual calendar, I think of what their day is going to look like can be really helpful, especially when there's going to be changes, if there's, like the weekday versus the weekend, which staff member they're going to be with or which family members they're going to be with, of having it really nice and clear, maybe think about, maybe they need to be bigger pictures, that if their eyesight is declining, that maybe they were able to read before, but maybe they're not reading quite so well anymore. And so maybe we need to have more, more pictures, or sometimes another thing that can be done is, for people maybe whose eyesight is really, really diminished is, having tangible things that represent where they're going to be, so that like there's something that they can hold that represents, that they're going to their day program, or like it's a car or something, and so then it's a kind of a tangible, support rather than a visual support. So that could be a strategy, but I think having like, and having clear, predictable routines, and try to keep it as much as possible the same from day to day, because that gives that sense of predictability, like I mentioned. Like, all living organisms need that sense of predictability and control. And so that helps to give them that sense. The more that we're able to kind of give them a nice stable routine so they know what to expect every day, we're preparing them ahead of time if there's going to be a change, because sometimes there's a doctor's appointment, and that's different from their daily routine, but just making sure, the kind of giving them lots of reminders. Okay, this is coming up. We're going to have a change, I think those are things like the kind of basic things that can be helpful.
It's interesting because I think a lot of people who I've talked to, they wonder, and I would wonder too, is it better to tell my loved one ahead of time and have them worry about it and ask about it for 3 days? Or is it better just to tell them at the moment that we're leaving and going to the doctor? But it sounds like you're saying advance warning and preparation is good, right?
I think it probably depends.
Yeah.
Sure. I know it's so tricky, isn't it?
Yeah.
For Matt, if we were to do that with Matt, knowing before the day that it's happening is, it's like if he knows he's coming up to visit me, we don't tell him until the day that it's happening, because then he just perseverates on mom, and then he gets agitated and stuff. The visual calendars, we've used those. We had used them for years. We used them, and then we got some new staff, and it wasn't carried over. And we just found them the other day, and it's like we need to reinstate this. But we had those cheap little photo albums, like you buy at the drugstore for $1. Well, they're probably $15 now, but they were $1 back in the day. And, you can put a picture in. And we had a picture, like a picture of him brushing his teeth. And then you flip the page, and there's a picture of him eating breakfast, and a picture of the car, and picture he used to volunteer at the VA Health Center. And so he could go through the photo album and each major thing that was changing in his day. And so if he started wanting his afternoon iced coffee, the staff could then say, Matt, first we have to have lunch and finish work, then we'll go for coffee and stuff. And that really helped. So we just realized about a week ago that that's not been used for some time, and so we're going to be reinstating it. But it worked really, really well with Matt.
That's great. Yeah, I think so much we have to like pay attention and follow the lead, of our loved ones, because you're right. Some, depending on what is their kind of current understanding of time and how much time is passing. And so, yeah, like giving them too much advance notice could be problematic, if they don't really understand the concept of tomorrow, or next week, and so I think you have to kind of scale it up and down depending on, on that particular person and how they respond to it. But it's worth kind of trying and seeing like what happens, because for somebody otherwise, like if you don't give them any warning and it's a big surprise, then that can lead to a lot of distress. It can lead to, so I think you have to kind of test it out and see like what's the right amount of time for this person. And over time, it may change.
And I think we're all used to knowing that our loved ones, their routines are so individualized, right? With what we do and how we work with them. But you said something earlier that I want to bring up again. And you said to simplify the routine, because when my brother was aging and going down the continuum with the Alzheimer's journey, we always used to repeat to each other, less is more, because taking in all these inputs, taking in all the information, trying to process, again, realizing if they already have trouble with that, receptive and expressive language, then now with a fragile brain and a brain that is changing, now we're asking even more of that brain. So simplifying and remembering the less is more concept was something that really was helpful to us in our situation, and not giving too many things at once. I mean, sometimes it was just as simple as a couple of words at a time versus a sentence, or just being there with the person, letting them know, again, for the anxiety reasons, because Matthew would get a lot of anxiety around too much stimulus, too many people in the room. When we had, his team of social worker and doctor, nurse, that would agitate him. But I do want to also address, because we were talking about concept of time. So I'm asking this for some listeners that have specifically reached out with this question. I'm working with some friends that have a sister, and she's on the journey right now, and time is becoming very stressful to her because she can look at the clock, and I think I may have emailed you about this. She doesn't really understand what it all means now. Is it better to remove the clock from the room, to not use the clock, or do we continue to try to find ways that help her understand? Or has that ship sailed?
Yeah, I would think probably, I mean, not knowing kind of what else is, kind of
Sure.
going on. I think that probably, yeah, that's a good example of simplifying and removing things. Like if that's a source of distress, and I think, at this stage of life too, where it's unlikely that they're going to, like, this is not going to be a skill that they're going to gain or recover at this point too, of saying like, what are the things that we can just, kind of simplify to make their life easier, make this phase of their life easier. For somebody who's younger, earlier in their life, then you might work with them on kind of clock recognition skills and things like that, because they've got, time, they may benefit from, from having that skill. But if that is becoming a source of stress, in this phase of life, it may not be serving its purpose anymore. And so thinking through something, more like what Jadine was talking about with like a flip book of, and so rather than having things anchored to the specific times on the clock, having them anchored to, just the order of activities. First we do this, and then we do that, and then we do this, may kind of remove that piece of, of stress from the equation.
So Ruth, you talked about sometimes medication can have adverse side effects and cause anxiety. Are there like some top offenders that you can think of?
I mean, I think there are general recommendations, like the American Psychiatric Association, urges caution with certain medications, and in folks who have Alzheimer's, including some of the like antipsychotic medications and and things like that.
Yeah.
And not to say that they shouldn't be used,
Yeah,
but that they have a unique, they have their own risk profiles that need to be balanced against the benefits that it may offer. And so I think that those are, so I think as much as you can find a psychiatrist, or a doctor who's familiar both with Down syndrome and Alzheimer's, which can be a tall order
Yeah.
in that space. But maybe kind of, reaching out for some consultations, maybe with some of the Down syndrome clinics, you can, do a consult. So you don't necessarily they don't have to become the regular provider, but, can provide some information or whatever could be helpful, to just kind of think through that risk and that risk benefit kind of profile.
and just be aware that, I mean, that's your point, right? Just be aware that there are medications that can cause anxiety, and if you don't have a specialist, then you really need to kind of be on the lookout for side effects of medications. It's good.
Yeah.
It's a good thing to keep in mind.
Yeah, and have those conversations, I mean, I think just, generally with any healthcare provider, if you have concerns, you have the right to ask those questions and have your concerns addressed. And so be willing to, bring up those concerns, write them down on a notebook so that you remember. I have that, just whenever I have a million questions I want to ask my doctor, and then I'm in my doctor's office. So they're like, how are you doing? I'm fine.
Why am I here?
Yeah. Then I leave and I'm like, oh, I was going to ask about this, that, the other.
Yeah, I do that too. I do that too. Speaking of doctors, if we are suspecting that our loved one is maybe getting anxious, is there a specialist that we seek, or do we go to a mental health counselor? What's the process? If I notice that, of course, I'm going to use Matt, but I already know he says he has anxiety. But say I've never known that before, and I'm thinking he seems awfully anxious lately.
Yeah.
Where do I go? How do I start?
Yeah. Ideally, kind of behavioral and mental health interventions would be the first line of treatment. And so that would be working with a psychologist, a therapist, a social worker. I mean, there are a lot of different kinds of providers that provide mental health counseling, to folks. It can unfortunately be challenging finding mental health providers, especially adult mental health providers who have experience with people with Down syndrome or other intellectual disabilities. And so that's a real problem. I think it's just a real challenge that, that we have in our healthcare system. But that would be ideal, and then also, kind of some of that kind of caregiver mediated parent training, kind of, support, interventions in place, things at home to kind of help them. There's always a balancing act, with that, for somebody who's experiencing anxiety, because on the one hand, we can try to protect them and try to make their life as easy as possible and remove all stressors. And it kind of helps in the short term, but sometimes that sets them up in the long term to be more and more and more fearful, for accommodating every anxiety. So that's the kind of risk on the one hand. On the other hand, forcing them into situations that are stressful, it can be hard and can cause, anxiety. So there's like this kind of balancing act. And then also just like this kind of idea of like dignity of risk, that if we try to protect them so much, try to take away everything that might be stressful to them, we also start to like shelter them too much, and then they don't have opportunities to grow and to develop. And it's a balancing act, and it's challenging, and it's another one of those things where it's like it's going to depend on the person and kind of where they are and what their environment is, and and all of those kinds of things. A mental health provider would ideally be kind of getting a big picture of the of the person, like what are the things, like where is the anxiety showing up, what are the things that we can do to kind of like, are there unnecessary things, can we simplify and back things down point. Yeah. But what are the things where we can help them to learn how to face these challenges? Are there kind of irrational fears that they've developed, around, going certain places or doing certain things? Are they anxious about going into public restrooms or something like that? Like that's the sort of situation where like probably they're going to need to go to a public restroom at some point in their life. And so this is the sort of thing that we want to then help them to learn how to gradually face. So we kind of put together a whole kind of intervention plan around helping them to gradually get more and more comfortable kind of going to a public restroom. Sometimes it's a sensory issue, and what they really need is maybe just some headphones that they can put on while they're in the public restroom, because the toilet's flushing unexpectedly is distressing. So it takes some good detective work to figure out kind of sometimes like, oh, you see a behavior and like what's driving it and what's the source of anxiety, and how can we, is it some irrational belief, some irrational fear, or is it a sensory thing? So I think like consultations with like occupational therapists are also amazing. And that's another, and I think especially within kind of disability populations, occupational therapists probably have more familiarity, kind of with this population than most mental health providers do. And they can do a lot around emotion regulation, around desensitization, kind of around, sensory kinds of things and stuff too. So I would say if you can't find a mental health provider, look for an occupational therapist or both. I think do both, because the occupational therapist can also kind of come into the home too, and kind of be looking around their environment and thinking, how can we make some adjustments here and there to make it easier for them too. So those are the sort of interventions. So kind of mental health counseling, if the person, I think oftentimes people with Down syndrome aren't given the opportunity to participate in therapy, and I think oftentimes they can, but not everybody can, and so sometimes it's going to be more working with the caregivers, and learning how to help, and kind of coaching the caregivers to support the person, at home. So those are some things. What else? I feel like I maybe have gotten off.
This is
it's really good.
Two things that you brought up, which I'm glad you mentioned, because it brought me back to our own journey. You said involving a mental health specialist. Earlier in Matthew's journey, we did have to involve a mental health specialist that was very knowledgeable in adults with developmental disabilities and mental health, because he was having a lot of anxiety around changes in routine, maybe things that were changing in the household, siblings moving out, things like that, which led to some depression. But also then things that developed into hallucinations. And we did have to go through that route of putting him on some antipsychotic medications, antidepressants, and a lot of it, sadly, it's just trial and error, right? You hate to see your loved one have to go through this, but you have to see what side effects they have and if it's working. And I just want people to know that this could be a normal part of what what we're dealing with, that you may have to try. And, we don't always want to be anti-medication, because on the flip side, then as the anxiety issues increased with Matthew, we did have to put him on some anti-anxiety meds. And that was really, really helpful, just to calm him, just to take the edge off. Nothing major, just low dose medications. And that really helped. The sensory piece that you brought up, I think, is also very important, because your suggestion of headphones or coming up with adaptations that might help them. We had a fidget blanket that we ordered on Etsy for Matthew, because we customized it to the things that he liked, and he just sat with it on his lap. And, instead of always having his hands moving or feeling that source of anxiousness, he would hold the fidget blanket and he would twiddle something that was on it, or wrap his hand around something. That was something that was very helpful to us. But then the sensory things, showering for a lot of our loved ones can be very scary and frightening, because of the feel and the sensation of the water. If they're not connecting anymore, what's happening. And those are things that, even it might just be as simple as switching over to a bath instead of a shower if you can, or doing a sponge bath if you can. So thank you for bringing that up about the sensory issues, because I think we often forget, or may not even know, that as we progress in the journey of Alzheimer's specifically, in the typical and Down syndrome population, those are very common things that we run into. So I appreciate that you reminded us of that.
And Kristen, I love what you're saying, because it's actually tracking with our experience too. And I'll tie it back to Ruth. Something that you said that I found really interesting is when you're talking about involving mental health professionals and or OT. Those sound like great solutions for our older individuals before they have Alzheimer's, and maybe at the beginning stages when they can still learn and when they're still able to retain information and do things a different way and all that kind of stuff. And I love it, because our older folks are more likely to be going through changes at home, like their parents are aging, their siblings are moving out and getting married and whatnot. I think those are common life situations that can cause anxiety for our folks, even before Alzheimer's shows up. But after Alzheimer's shows up, having an OT involved in a different way, I think, is really helpful. And at least it was for us. We had OTs come to the house, and quite frankly, I was their patient as a caregiver. They were teaching me how to do things to decrease the stress on Aunt Kathy, rather than teaching Aunt Kathy how to do things differently. And it was really helpful, because, like you said, they seem to be more like detectives than any other medical profession I've come up against, and they problem solved with me in really personalized ways, like specific to our house, specific to Aunt Kathy, and specific to how I was working with her. So I love both of those ideas for different stages in our older adults' lives. So thank you.
Yeah, and that, thinking about anxiety too, kind of early on, there's some interesting theories that are out there, and they haven't been explored yet, to my knowledge, in people with Down syndrome, but just in the general kind of aging and Alzheimer's kind of research about the connection between anxiety and Alzheimer's. And there's some, like, these kind of two competing theories. One is that, anxiety, kind of earlier in life, because it's observed that anxiety often precedes Alzheimer's, similar, and we see similar problems with depression. Depression kind of often seems to precede Alzheimer's. And so there's this question of, like, is there some sort of a causal relationship, And so one theory suggests that kind of early anxiety, increases cortisol, the stress hormone circulating in our body, and that leads to deterioration of the brain and causes inflammation. It causes, kind of wear and tear on the body and on the brain.
Like a trigger.
Yeah. And that can kind of increase risk for Alzheimer's. The other kind of competing theory is that, like, it's not causing it, but that the anxiety is an early warning sign, that it's a sign that the brain is starting to, like, in certain, parts of the brain is starting to deteriorate, and that's leading to anxiety. And there are some, some changes. There's, like, some of the parts of the brain that the kind of the inhibition parts of the brain are kind of coming, kind of coming offline, and so the person is more likely to, be aggressive or react or, kind of anxious. So that at the same time, the emotion centers of the brain are becoming more, more activated or whatever. So there's kind of evidence for both of those things. And I think probably it's one of those things where they can influence each other, that if somebody kind of already has increased risk for anxiety, if they are already, kind of more anxious, then that can increase it kind of pre-existing, and then it kind of creates this feedback loop. So I think the more that we can do earlier in life to support people with Down syndrome who do experience a lot of anxiety throughout their life, I think would be really helpful in thinking about how we can kind of maybe prevent, reduce some of the decline later on, is really important, and something that there isn't enough of yet. Thinking about how can we support, I think that there's a lot of stuff that we kind of accept as common in Down syndrome, a lot of that, like the kind of rigid routines and, and need asking what are we going to do? Like, we see a lot of that even in younger people with Down syndrome, and some of the, specific phobias and, and things like that. And I think to some extent people have normalized that within Down syndrome to say like, oh, that's just, part of Down syndrome. People with Down syndrome are anxious or, that's, and I think we need to kind of take a look at that and think, what are the things that are actually modifiable? What can we actually help to reduce some of their anxiety, rather than just, just accommodate it earlier on, so that then hopefully maybe we can prevent some of the decline later on.
I wanted, and this is probably just quick, is sundowning in Alzheimer's,
Yeah.
is that a
Thank you.
type of anxiety? Is it caused by anxiety, or is it the same thing?
Yeah, it can be. Yeah. Sometimes we think about it. I guess I think I have heard about it more often, and in terms of kind of depression, or agitation kinds of symptoms. But I think probably for some folks, I think it probably is an increase in, and kind of anxiety. And I think that is could be a part of that.
And do you have any suggestions what might help? Because that is a question that comes up a lot. How do we deal with the sundowners?
Music therapy is one that I see a lot kind of recommended, which I think is fascinating in terms of like the things like the interventions that are recommended, like, for addressing Alzheimer's. Is music therapy is one of the, kind of strongest recommendations. And I think it's so fascinating. Like I haven't, it's not something that like I've been like trained in like myself. So I don't have a whole lot of experience with it, but I find it fascinating. But what I've heard is that like, specifically playing music from earlier in their life is beneficial, and so maybe like, just kind of factoring into their daily schedule. If, like this is a time that's stressful, of just like kind of working in like, this is our music time, to kind of help provide them with some comfort during that time, just kind of plan around that, kind of recognize that this is maybe a new part of their daily rhythm, if this is that's happening, and then just kind of planning around that and saying like, let's have, we're going to drink some tea and listen to some music, and playing music from their like kind of early adult, find what works for them. But the idea is like finding music from when they were like, 15 to 25 or so, that kind of peak time, just other music that brings back kind of happy memories, and have some time and I think, and I would love to see, there's so much, the kind of idea that there's like a music gene on the 21st chromosome, like
I believe it. Kathy loved music and singing. I mean, that was her medicine.
I would guess that there's got to, that like, kind of
There's
music
something.
therapy is recommended for people with Alzheimer's, but I would guess it would be even more powerful for people with Down syndrome.
Yeah, it's such a good reminder, because that is something that is such a part of so many of our loved ones' lives, the music, the connection to music. And it's almost like going back to taking care of a baby. I feel like in the evening, what you do with your children when they're young, you have a routine and you start to prepare them for, we're going to read a book, we're going to take a bath, we're going to, put some lavender oil on you, whatever it might be. Then we're going to play your music. So I think even, again, stressing the importance of routines can probably, and I know from experience, be very helpful, because we did do that in the evenings with my brother. We always put on soothing, calming music. And even during the day, though, music would calm him if he was starting to get upset. So thank you for reminding us of that. If we're going to ask a few questions, just kind of back and forth quickly, I want to hit on a couple of other things that people have written to us about and asked about. Sometimes there's hair pulling or scratching a certain part on your face or your head, or, almost to the point where you break skin. Are there any specific things that you've seen that have worked in individuals for any of those types of behaviors?
Yeah. Some of the things like, kind of hair pulling, skin picking, can be tricky. They're kind of like these kind of habit disorders. And so sometimes what helps is to try to like kind of replace that with something that's less damaging, to kind of give them something, sometimes like rubber bands to snap, instead, could be helpful. I've seen some people just have to resort to like shaving the person's head, if this hair pulling is really bad. And sometimes that breaks it and that's it. But sometimes as soon as the hair comes back, it pops up again. But playing around with, some gentle redirections, is helpful. I think trying to do things in a calm and a regulated manner, I think is really important. This idea of co-regulation, where if a person is upset, we have to like make ourselves more calm rather than matching them at their level or whatever. So being calm and trying to just redirect their hands, putting something else in their hands, finding something, yarn or something like that maybe they can fit in a hole, can be helpful. Checking for potential sources of pain, like, are they skin picking because their skin is really dry? Is there like, are there, again, that detective work of kind of thinking through.
Yeah, that's a great point, though. Don't miss something in the middle of all of it.
Yeah. So kind of get them all checked out and make sure, there's no constipation, there's no stomach GI things, there's no, kind of skin things, especially the big things that we know are more common in Down syndrome, UTIs, that sort of stuff can be important. But then, is there something we can replace it with, that sensation, if it's a sensory thing, could be helpful.
Something I also thought about, you said something that reminded me of it. I don't know exactly what it was, and I don't know if I'm using the right term, but we did it with Matthew, and it was like skin brushing, or you can order a certain type of very soft bristled brush, and we made it, or we tried to make it part of the normal routine, because that did seem to help reduce, or it could reduce anxiety. And there's a way that you can look it up on YouTube. Our massage therapist told us about it. And that maybe is another idea too, massage therapy, in addition to the music therapy. But that skin brushing, where you just do gentle, there's a pattern from where you start, which limbs you start with, how you do it. But that, I'm guessing, could be something maybe our listeners don't know about, that it's important to look into. And that could be something incorporated into a daily routine.
Yeah, I think that's a great idea. Yeah, that like just physical touch, is calming, it's soothing, and it's, human connection, I think, too, like having somebody else, like that we trust kind of doing that, I think having those relationships is important. If it's somebody that is in a group home or, has a staff, like making sure that that's a good, healthy relationship, because they may not feel comfortable with anybody, kind of, touching them, but that could be really powerful too. I like that idea.
That's a good reminder. Kristen, I looked into sensory therapy for Aunt Kathy. And Ruth, I'm wondering, because sensory therapy was not something that I had ever heard of, but Aunt Kathy, as she started to decline and get into the mid and later stages of Alzheimer's, was really gravitating towards sensory activities more than anything else. And so when I found out about sensory therapy, I was like, oh my gosh, I would love to get a sensory therapist in here to work with her. What I found was that they're not very common, and when I did find them, they were relegated to children's hospitals. I didn't find any that were working with adults, let alone people with Alzheimer's. Have you ever heard of that as an adult therapy?
Yeah, it is. The division between like child and adult services drives me bonkers.
Me too.
It's so frustrating. I was trained originally as a child and adolescent therapist, and so at the hospital here at the clinic, like I'm in the child department, and so even though the training, because I've gotten training in adults, kind of beyond that, it's like it's a child clinic, and we see people up to 18 or maybe up to 21 if they haven't, it's like, so it really frustrates me. That's another topic. um, but yeah, so it is a challenge, but again, maybe like an OT may be able,
Yeah.
another person that might kind of fall
I
within.
think it's an OT specialty. I think you're
Yeah.
right. But what we ended up doing was just watching YouTube, like you said, Kristen. We just watched YouTube videos and did it ourselves.
Yeah, yeah. I think some of these things, I mean, not to diminish the hard work and credentials that people, that people have, but I think there's a lot that can be done. Some things you do it the wrong way, it's going to cause harm. I think, brushing somebody with a brush, like if you brush the wrong way, like it's, like there probably are better ways of doing it, but it's not going to hurt them, if you brush it the wrong way. So I think, those are the sorts of things that I think probably getting suggestions online on YouTube can actually be beneficial.
So Ruth, is there anything that we haven't asked you that maybe you are thinking is important for our listeners to know about anxiety and our older folks with Down syndrome? Any little gems?
I think one thing that maybe we did talk about, I mentioned that idea of like kind of co-regulation, and that kind of like I think touches on also kind of being mindful of the emotional tone that the kind of caregivers have, whether that's like the listener or maybe the kind of support staff that the person has, I think is so important. So making sure that like people are taking good care of themselves, the kind of good self-care kinds of stuff that we kind of talk about, which doesn't necessarily mean taking bubble baths and going and getting massages, but sometimes it's a matter of like take 5 minutes in the bathroom, like turn the fan on the bathroom, close the door, and take a few extra minutes to like take some deep breaths and recenter yourself. Making sure that like their support staff are well supported and stuff too, so that they can be a calm presence in the person's life. And I think this is another thing where, I mean, I think it's true, in kind of Alzheimer's in general, but for people with Down syndrome, like there is an emotional like empathy that is there, where they pick up on other people's emotions very, very easily. Yes. And if somebody is agitated or upset, or like they are going to feel it. And so I think for caregivers, like in addition to just it being important to like take care of ourselves, it's important for the person that we're supporting, to be in a good place as much as possible and to be calm, in order to support them and help them to be calm. And so I think that's the other thing that I would just mention.
I think that's a great point, because I know when Matt was younger and at home with us, he would pick up on the energy in our house. My husband was in law enforcement, and he sometimes was in the house like a cop. And I've always been, the snuggly, cuddly one. And Matt always responded better to my snuggles and cuddles than he did to Joe's stern voice. And I think that's important to know as we're providing care as our loved ones age, whether we as parents or family members are the care providers, or our loved one lives away from us and has support staff, that anyone who's in their environment needs to realize that that's part of the environmental modification. It may be, are we speaking loudly? Even if we're just, hollering from one end of the house to the other to find out, are you ready to come to eat? That may be misinterpreted as them as being in trouble and getting, and feeling like you're angry at them. So I think we need to kind of monitor how we're communicating with our loved ones, because I know for Matt, it can set him off. If people are agitated around him, if he's around people that are arguing, it will upset him and get him agitated. So very good point. Thank you. I'm wondering, are you aware of any resources that families could access? Because you've shared a lot of great information, and I had never thought of an OT for anxiety. I think mental health, not looking at how they could adapt the environment or whatever. I'm a producer of products, so I'm like, okay, I see a checklist. Have you checked this? Have you checked this? How can you do this? Did you take pictures of where you're going so you can do that calendar? Any resources that you could point us toward?
Let's see. Well, I think like the NTG, kind of website has a lot of really great resources. So that's one that I, for kind of aging, thinking about aging and the intersection of, Down syndrome and Alzheimer's. And another, in terms of just thinking about visual supports, there's a website that I really like called do2learn.com, or is it .org? It's DO, the number 2, learn. If you just Google that, that'll bring you to the right. It's, and they have a nice selection of things that are for like children, but also things for adults with disabilities. And they have some really great examples, and some like freebies on there too for developing like visual supports, and kind of thinking through, addressing emotions and addressing behaviors and things like that. So like that's a really great, and they've got tons of free resources on there. So that's the one that I go to, and just kind of therapeutically, it's one that I go to quite a bit for myself, for like working with clients, and kind of finding, kind of quick and easy visual supports and stuff. So that's another one of my favorite. So it's not specific to aging per se, but it's specific to children and adults who have, neurodevelopmental disabilities.
And it was do2learn.com.
Okay. Oh, perfect.
Yep. So we know that one. Yeah,
Thank you for joining us, Ruth.
Yes, it was a pleasure. Thank you. Thank you for having me.
Your insight and your knowledge and the examples that you gave have been so helpful, because I'm not going to lie, this episode has been long awaited. Anxiety is such a big topic and people really want to know. And if we miss something, we would still love people to email us or put it in the comments, or if there's other questions that maybe, Ruth, if you don't mind, if we continue our relationship and reach out to you so we can get back to answering some things that we may have missed, because this is such an important topic that we needed to address. And I'm thankful and grateful for your time with us today and everything that you had to share. Thanks so much.
I was sitting here, I know I'm the elder in the group, and I was sitting here like a proud mama, watching this I'm getting chills, watching this unfold, and knowing that, we're starting to reach families that haven't been reached before, who've been left in the dark. And I was just sitting here going, I'm so proud of these girls. Look at this.
Well, yes, I know, right? Like, it's going to get out in the world.
Mm-hmm.
That's
Yeah.
And I just love the conversations. I mean, so many things that you were saying, Ruth, it's been, my brother died in 2023, and you're not living it every day like we were for so long. And it reminds me of things that we were doing and things that I completely forgot about, that it's like, oh yeah, I forgot about the brushing, or I forgot about the music therapy. So I love that these conversations elicit so many things from our personal stories, but that you bring out the professional side of it, and we can combine it with the personal side of it and really hopefully make it meaningful to somebody.
Well, I can tell you, Kristen, that I was taking notes. It's like, ooh, I need to try this with Matt. I need to bring this up because this might be helpful to Matt as he's moving through this journey. So absolutely. Yeah.
I'm so glad you talked about music too, because man alive, huge. Was that was a huge thing for us. We pulled a music therapist in, and you know what? I did the music therapist, and I was looking for the sensory therapist only because I thought it would be good for her to have somebody else to interact with some of these things. But even before we pulled the music therapist in, and in addition to the time that we spent with her, I would sing with her all the time. And even when she lost her ability to talk, because she had aphasia in the last year and a half, maybe even 2 years, she would still mouth the words. And even at the very, very end, she would start to mouth maybe one of the words in the song. And when I say the very end, I mean like 2 days before she died.
Wow.
Like while she was still not eating or drinking, and hospice was there and whatever. And she had her eyes closed, and she still started to move her mouth for some of those words. And I mean, it was like, that connection is so powerful in their brains.
Yeah. There is something fascinating about like music and the brain. And I think it's like it's in a different part of the brain. And evidently, like, in Alzheimer's, it's preserved for much longer than everything. And then you have like stroke patients, who like lose the ability to speak, but they can still sing, or people with severe stutters.
And Tourette's, yes.
Like it's just, there's something, in another life, maybe.
And you see, there's so many of these reels that you see, on social media that you go into, and they're just in the Alzheimer's units or memory care units, not with Down syndrome, and they can sing, and they can, they do this all the time, and it's so fascinating and beautiful.
And what was really interesting to me is that at a certain point, my mom even asked, like, do you think it's doing her any good? Because she can't sing anymore. Like, she's not actually singing. And so I looked it up, and I found a research paper where they did brain scans of people who, like, they divided up into categories. One group of people sang along with music. Another category was instructed just to think about singing. And then another category was just passively listening. And all categories had increased activity in their brains. And surprisingly, the group of people who thought about singing but didn't actually sing had the most activity in their brains.
Interesting.
It was fascinating.
I think about singing a lot and don't do it because...
Well, then your brain is really active.
Matt's the only person in the world who tolerates my singing.
Well, there's the unconditional love, right? You could have the worst person and they love it anyways. So, well, this was really great. This was a fun conversation and very meaningful and useful too. So thank you so much, Ruth, for joining us today.
It was nice to meet you.
It was so nice to meet you. Thanks.
All right.
Okay, bye.
Thanks, everyone.